just want to thank everybody for being here. And it's amazing because I have been in this community about 9 months, and I look out and I see faces of people like who I really like and I feel very connected with. And you know, to have that happen so quickly is, I think that says a lot about who and what Greeley is. And I felt from day one very grateful to have been selected for this role, and that continues every day. Our first presenter is going to be Raisa, and she is with the Weld County Department of Public Health. She's going to be talking about the recent community health survey that they did, and there's some amazing information. Her focus will be how that intersects with housing, but there's a tremendous amount of information, and she'll help you see that. And then there's one other thing before we get started. Maria, if you don't mind coming up. Maria is one of our case managers on the new city's Housing First team. And one of the reasons, I mean, Maria's a star, and she's done a lot of work already in the community, and she's also bilingual, which was really, really important for us when we were looking to hire people. So go ahead and say what you...
Okay. Buenas tardes. Si hay alguien que necesita servicios de interpretación, por favor búsquenme y yo les ayudaré.
Maria's letting people know that if you would like some translation, she is available to do that. So, all right, Raisa, you ready to come on up and kick us off?
Well, thank you, and thank you for having me here and for having the health department here to talk about our community health survey and how we think it relates to housing, or the stuff in our survey that relates to housing. Before we get into some of our findings, I want to give you a little brief overview of the intent behind this survey and the methods that we use, so how we implement this survey. Weld County has been doing this since 2007. It happens every 3 years that we send out invitations to take this survey. And over those years, we have heard collectively from about 15,000 residents in Weld County. In 2022, we had 60-some questions on our survey, ranging from the types of things you might expect. We asked residents about their health conditions, things like diabetes, high blood pressure. We asked about healthy habits, things like diet and exercise. And we ask about some not so healthy habits, substance use, distracted driving. We want to know about healthcare access. We want to ask whether or not people have insurance, what type. We want to know about the preventive health screenings that they get. But we also ask questions related to the social determinants of health. So things like the built environment around us and housing. And if that term's unfamiliar, the social determinants of health refers to those non-medical factors that can influence our health outcomes. So it's kind of the conditions that surround how we're born, how we live, work, grow old, the things around us that can affect our health.
Do you mind giving just a very concrete example?
Yeah, so if you live in a food desert, if your house is not located near a grocery store where you can buy fresh fruits and vegetables, that can affect your health, right? That might mean that you're not eating the recommended number of fruits and vegetables every day if you physically are just very distant. That's one example. But it's pretty endless the ways that this ties together. So the way we do this is we randomly select a list of addresses that we get from a vendor who gets them from the post office. We invite one adult per household to participate in the survey. So this survey does not contain youth data, it's just for adults. And residents had the option of taking it either in English or Spanish, and they could do it online or on paper. We fielded this survey from May to August last year. Fielded means that's the period of time in which residents could take the survey. And we use a tailored, responsive, mail-based design. That means that we use our previous survey history to guide implementation the next time that we do it. So we try to learn from what we've done in the past and tailor our next iteration. This approach means that we try to put ourselves in the shoes of the survey recipient. So we try to ask questions that are easy to understand, that are interesting, and that will be useful. And then that also involves making sure that recipients see their survey as legitimate and that they trust that once they fill it out, the results will be used. So hopefully that's what we're seeing here today. We do a variety of different things to make sure that our results are as representative of the county as possible, and one of those things is geographic stratified sampling. What that means is that we might sample different areas of the county at different rates to make sure that we are hearing from everybody, and not just people in certain areas, or not just people who are super interested in taking our survey. And we use repeated mailing waves, so we may send up to 5 reminders to people to nudge them into taking the survey. In 2022, our overall response rate countywide was 11%. For this presentation, though, I am just going to focus on presenting results from zip codes 80631 and 80634. So we're going to set aside the countywide picture that we're often focusing on and just narrow in on Greeley for this presentation. Okay, so I'm going to shift to talking about some of our housing-related findings from the survey. But first, why are we asking about housing on a health survey? Because housing and health are tied together in a variety of ways, right? So our health is not only linked to the actual physical structure of the home that we live in, but it's also linked to the neighborhood and the community where the home is located, right? So, for example, do you have a safe and accessible place near your home to get out and exercise, or for your kids to get out and play? Housing instability and financial pressures related to costly housing are associated with stress, anxiety, chronic conditions, higher risk of overall mortality, and also homelessness. Living in poor or substandard housing has also been found to be associated with some respiratory diseases and certain types of cancer. So one thing that we want to know is the percent of residents who are experiencing what we call an unstable housing situation. And to assess this, we ask 2 questions. We ask, in the past 2 months, have you lived in stable housing that you owned, rented, or lived in as part of a household? And then the other question is, are you worried that in the next 2 months, you won't have a stable place to live? And if they said yes to either of those 2 things, we're going to classify them as having an unstable housing situation. So we found that 16% of Greeley residents reported an unstable housing situation in 2022. That translates to roughly 13,600 adults in Greeley. You can see from those top 2 bars, I know it's a little small, but that Greeley had a little bit higher rate than the county overall. And you can see, looking down at the navy blue bars, that not every group of people experienced the same rate of unstable housing, right? So it was higher for those residents in Greeley that identified as Hispanic or Latino. It was higher for folks in low-income households, so those making $25,000 a year or less had a higher rate of unstable housing. It was also higher among folks with less education, so adults with a high school degree, GED, or less. This is a new question on our survey. We wanted to assess the percent of residents who are housing cost burdened. And what this means is people that pay more than 30% of their income on housing associated costs. So that could be your mortgage or rent and your utility payments. And what we found is that more than 1 in 3 Greeley residents said that they spent 30% or more of their incomes on mortgage, rent, and utility payments, meaning they're housing cost burdened. So this was higher for residents, for renters than for homeowners. Almost half of renters said they were housing cost burdened. But we do think it's really notable that even among people who own their own homes, 30% said that they were housing cost burdened. This is also higher for people living in mobile or manufactured homes and in apartment buildings. 50% of them said they were housing cost burdened. And then it's higher for young adults than for the older age groups. More than half of those aged 18 to 34 said that they were housing cost burdened in Greeley. We ask an open-ended question at the end of our survey where we invite residents to share what they think are the top 3 health concerns for them, their families, or their community. And I pulled out this quote to share with you because I think it really relates to the meeting we're having today. But this person says, "Rent is insane. I have lived here most of my life, cannot anymore. My kids and I were homeless for a month and a half, women's place, etc. Need more help, resources, please. So a lot of people did bring up housing in this section where we asked about their top 3 health concerns. At the county-wide level, it was not one of the top 8 themes that we saw emerging. However, when we looked at comments just from people in Greeley, housing was the 5th most mentioned health concern for Greeley residents, and then homelessness was number 8. Another thing we look at is the rate of doubled-up housing. And what this means is having more than one family unit living under one roof. And to make this a little bit clearer when we ask it on the survey, we give this example. We say, okay, so you have a married couple and their adult daughter and her children come to live with them. That's 2 family units living under one household. That's doubled up housing. And what we saw was that the rate of doubled up housing increased from 10% in 2019 to 20% in 2022. Another way of saying that is that 1 in 5 Greeley residents have more than one family living in their home. Again, this is higher for folks in low-income houses. For those earning $25,000 or less, 1 in 3 or 33% said they lived in doubled-up housing. And it was also higher for Hispanic or Latino residents. So we all know that stress is bad for our health. And we ask a series of questions on the survey where we ask residents how worried or stressed they are about different topics. And when it came to paying rent or mortgage, we found that 31% of Greeley residents said they were worried or stressed about being able to pay their rent or mortgage. We asked residents if they had provided temporary housing to someone else during the past year, and we found that 18% of Greeley residents had provided temporary housing to another person in the previous year. 13% of Greeley residents said that they needed housing services in the past year. This could mean rental assistance, utility bill assistance, use of the LEAP program, or use of shelters. And that 13% represents about 10,000 people, 10,000 adults in Greeley. For a little more context, broken apart, it was pretty evenly split between people who said that they needed these services and that they used them, and people who said they needed the services but didn't use them. So one question that we ask at the very top of our survey is we ask residents to rate their own health on a scale of poor to excellent. So it's poor, fair, good, very good, and excellent. And when we break that apart and we group together people who said their health was fair or poor, and group together people who said their health was good, very good, or excellent, what we found is that more residents who said they had fair or poor self-rated health needed housing assistance compared to those who had good or better health. And I'll bring in another quote from a resident here who explains how housing impacts health in their family. Cost of housing for my adult children is a health concern because they mentally are struggling to make ends meet. They barely make enough to pay for rent, and purchasing a home seems out of the realm of possibilities at this point. We asked residents for their level of concern about a variety of environmental health topics. And so again, looking at this group of folks with poor or fair health, we're seeing that they have that more of them are expressing concern about outdoor air quality, pollution from oil and gas operations, and a lack of sidewalks or trails for walking or biking. So before I go, I want to share a couple of resources that are related to the Community Health Survey. If you go onto the Health Department's website, there's a whole bunch of reports that we've published out of this survey and out of our community health assessment activities. One is a key findings report. There are a few copies available on the tables outside, but this goes into depth on a lot of the topics that we covered on our survey. There is also an online data dashboard on our website where you can look at every question we asked, see how people responded, and also see it broken down by demographics. We also have a focus groups report available. These focus groups were covering barriers to healthcare access and to behavioral healthcare. So again, if you go to weldhealth.org and you navigate to data and reports, and then to community health surveys, you can find information about our surveys going back to 2013. And then if you click on that data dashboard ribbon, you will be able to navigate to our data dashboard. So when you first open it up, you'll end up on this overview page with a bunch of information about the dashboard. But if you click into this center button, so you can select a topic from this menu. And then below it, you can select a question that we asked. And up at the top, you'll see this countywide estimate. And then as you scroll down, you'll be able to look at how people's responses broke down by age, education level, gender, income, race, ethnicity, and then region. So this has a whole bunch of information on it. Feel free to get on there and just click around and explore. But that is it for me now. So I will throw our email up here real quick.
Your information is very dense. I mean, it's wonderful. And that, like, if it was me, I don't know if I'd be able to remember my question until the end.
Yeah.
So just in case, if anyone has some questions now to ask about this.
You were talking about Greeley, but I think Evans, if you have any kind of information about Evans, because you can tell they are having a homeless housing problem too, and we're so close in the cities that actually we need to work together. Thank you.
Yeah, so we don't have quite a big enough count to be able to pull out just Evans. But if you go on that data dashboard I showed, it does have, we broke it down into 3 big regions that you can look at. And Greeley Evans is a combined region for that. And it's a combined region when we talk about it in our key findings report that's out there. So there are some things that you will be able to see, oh, okay, this is higher for folks in Greeley Evans than it is in the I-25 corridor area or in the rural areas of the county. So we do offer some comparisons that group Greeley and Evans together.
Thank you so
Yeah.
much. Very much appreciate it. So when I was in the interview process, I asked the panelist that I was interviewing with, I said, so what's the connection between the county and the city? And, folks said the goal for it to be stronger. And I got to say, my experiences so far with our different departments that are very much related have been great, and we're looking forward to increasing those partnerships for sure. So our next presenter is Kelly Pryor. She is the Executive Director of the Continuum of Care. She's going to give you a little bit of information sort of about that, because I know that's probably an unfamiliar term for people who haven't been doing the work for like 15 years, and we're always throwing around like those acronyms. So please help me welcome Kelly.
Hi, everyone. Yeah, so I'm Kelly Pryor. I'm the director of the Continuum of Care, the Northern Colorado Continuum of Care. I'm really excited that the turnout here. This is great. So I'm going to talk about what is a continuum of care. Why am I here talking to you about it? And then I'm going to dig in a little bit more into homelessness data specifically and what we're seeing, because the continuum of care is responsible for just gathering and making sure we have quality data on homelessness and people who were experiencing homelessness moving into housing. So to start, a continuum of care, or a COC, is a federally determined region. So we are determined by HUD, the Housing and Urban Development Department of the federal government, to work together to coordinate homelessness response. So that includes not only collecting data, like we're going to talk a little bit about more tonight, but also just the supporting resources and making priorities for our COC region related to how we are going to address homelessness. So concrete example, the Northern Colorado region, Larimer and Weld County, actually split off from a different continuum of care, the balance of state continuum of care in 2020, because as you can imagine, Weld and Larimer County's experience of homelessness and the resources that we need is really different than what homelessness looks like in the more rural parts of the state. And so we were able to successfully become our own region. It's only the second time that that's ever happened in the country. And so I think that really speaks to not only the level of support and coordination we already have going on around homelessness here, but also just the need that we really need to be focused on Larimer and Weld County in Northern Colorado specifically. So the vision of the COC is to make homelessness rare, brief, and only once. We understand homelessness is going to happen. People will unfortunately find themselves in situations where their housing might be unstable and they end up not having a place to live. But we really firmly believe that together we can build a system that can catch people right as they're exiting their housing situation or right before, and then quickly connect them to the supports that they need to become rehoused, and that they don't end up homeless again. So that's really what the continuum of care's purpose is. We do that a few different ways. So, and I'll get into more of the structure, but essentially we are a collective that sets standards of how we all work together. Anyone who's kind of involved in the homelessness space works together. We set priorities of how we're going to tackle this giant issue, complex issue that is homelessness, how we're gonna do it here in this area, what will work for us. We manage data to make sure that the strategies that we're trying to implement are actually having an effect. And then we advocate for policies and practices that are proven to work through evidence. So I'll get into some of this a little bit deeper here. So briefly, the structure of the continuum of care is we're not our own nonprofit. We're a collective, as I said. So we have over 50 partner agencies that have signed agreements to partner on and say, yes, we believe that homelessness is something that we have to solve together. No one agency is able to fix it. And so to do that work, we have two different lead agencies that employ staff to focus on continuum of care priorities. So United Way of Weld County is the COC lead or the lead convener. They're my employer, but they say, Kelly, go talk to whomever you need to talk to in Larimer and Weld County to help solve homelessness. So I am employed by United Way, but my mission is to be much more broad than just as an employee of United Way. Yes, that's a good point. So as I mentioned, continuums of care are across the whole country. The way that they are structured varies widely. Most often, it's one entity that is serving as kind of the backbone agency for all of this work. And then there's the partner agencies that are participating and making sure that we're doing what we need to do. In Northern Colorado, because we're so new, we've only been around a couple years at this point, we did not have one dual county agency that really could step into the role of making sure all of the work of the continuum of care was happening across both Larimer and Weld County. So our general membership, which they voted to designate United Way as kind of our lead to communicate with HUD, the federal government, and to make sure that we have staff that are kind of being more front-facing, community-facing. And then there's another agency that's based in Larimer County that serves as our data lead, or our Homeless Management Information System, HMIS lead. And I'll go into that a little bit more. But our general membership is comprised of, we have partners. It's most often a nonprofit or an organization, a local government, county government, department, things of that nature. But we do have individual community members or kind of local smaller groups that are focused and are interested in addressing homelessness in their space. And so they can become general members as well. And we hold meetings that have trainings and just information and lots of different things for our general membership. And then kind of narrowing that down, we have our governing board that really is intended to steer the work of the continuum of care and set these regional priorities, set kind of how does funding that's coming in through the Division of Housing or the federal funding, like how are we wanting to prioritize that, those kinds of things. I'm gonna skip this coordinated assessment placement system for a second and go over to our committees and work groups. So the COC general membership has, most of the work gets done in work groups, right? There's so many things. There's so much to do. There's so much to do to address homelessness. And so we have really tried to focus around certain aspects of the work. So we have a group that talks about using data, and we talk about evaluation, and we have a lived experience work group that's helping inform our system improvement, things of that nature. And then in the middle here, we have, I think what's most directly impacting people who are currently experiencing homelessness and getting them housed, and that's our coordinated assessment housing placement system. We call it CAHPS for short, CAHPS. Some people call it CHAPS, but it's CAHPS. So, and that's the process by actually identifying people and connecting them to housing, which I'll go into in a second. So, all right, that's the structure. We have our general membership, we have our governing board, we have our work groups, we have our priorities, all of those things. But how do we actually, how is that all working to end homelessness here in Weld and Larimer County? So the continuum of care strongly supports the idea of housing first. And so housing first is it's basically a frame of believing and like the way that you set up your, everywhere from the way that your program is set up to just the way you design strategy and policy at a much larger kind of bigger scale. But it's saying that housing is a first priority we need to have housing in order to address any of these other issues, right? So if we're thinking back to the data presentation from the community health survey we just saw, housing is a part of the social determinants of health, right? If we have housing, it's like foundational, then we can get to the doctor more likely. We can see a counselor if we need to. We can go use our walking trails and our biking trails because we have more time and we're not worried about where are we going to stay tonight. And so housing and getting people into housing first, that's the priority. Yeah, we didn't just say like, oh, housing first, we came up with it. This is a best practice. It's shown across not just the United States, but there's lots and lots of studies that have shown that shifting from the idea of people needing to be like housing ready, meaning that they need to be employed before they're allowed to have housing assistance, or they need to be meeting with a case manager every single week in order to be allowed to get this assistance. Like those are the things that Housing First basically shifts on its head and says the priority is to find housing. And then from there, we build rapport. We are going to figure out what your actual other needs are. We're going to connect you to all the other services you need because we've gotten your foundational need addressed. And we know where you're at, and we can come and bring services to you ideally. So The other thing about Housing First is that we really work to prioritize the most vulnerable and connect people to the type of resource or support that is best for their situation. And so what this looks like is, someone who's perhaps been experiencing homelessness for many, many years. They have not been able to access healthcare. They've not been able to access mental health, all of these things that take a toll on themselves. They're much more vulnerable, likely, than someone who's never experienced homelessness before. This is their first time. They have a history of employment and are able to navigate the system in a way to get themselves back into housing, and maybe they just need a little bit of rental assistance with a case manager to kind of assist them with the process. So those are two very different strategies to addressing homelessness. We need both of them because there are folks that fall into both categories. And then within that, we have people who are also folks that need rental assistance. Some are more vulnerable than others, and same with our kind of longer term people who need longer term, more permanent support. And so we're really trying to assess and identify who is most in need right now. We do not want people to die homeless. And also we want to, we know that we have scarce resources. We don't have enough to go around. So we really want to make sure that we're connecting people with the greatest need. And that's hard. That's a really hard place to be in. And then we also encourage lower barrier services. So basically trying to figure out the minimum need to make sure people are accessing life-saving services, like shelter and just basic needs, so that we can then get them into housing. That's another aspect of Housing First. So the COC does all this. We do this on a regional basis. So like I said, we're Larimer and Weld County. And really the reason for that is homelessness doesn't know boundaries, right? People are gonna go, they have lives that are connected. I'm sure you know people that live in Fort Collins, you know people that live in Loveland. People experiencing homelessness do as well, and people move around. And so you can't just solve homelessness in a city without it affecting your nearby neighbors. And so we're really trying to keep that approach and engage in kind of a regional strategy that's coordinated with one another, and so that we're not inadvertently making things worse for our neighbors. And we're all working together, and we're not trying to compete for resources. We're just doing it together. I've already talked about our committees and just best practices. So back to our coordinated assessment housing placement system, or CAPS. So there's a lot to go into this. I'm just gonna give you the highlights, but essentially this is a process that the COC supports, where we identify using our partnerships. So my team does not provide direct service, but we have many, many partnerships with the agencies that are doing the really hard work of trying to assist people experiencing homelessness. So we support our community partners to identify people that are experiencing homelessness, assess those folks for their housing needs and their barriers, and then we work to match them to the available housing resources. And by resources, I mean the spot in the rental assistance program, or this voucher that could pay someone's rent at this kind of, if they can find a landlord to rent to, or a actual unit that's in a building that's intended for people who were formerly homeless. And then we follow them and try to navigate all the barriers to actually get them housed, right? Because once someone gets a resource, that's fantastic, but it still takes quite a few steps in order to actually lease up and move in. So we follow along the whole way. Part of the way we do this is through real-time data collection. So we manage a system called the Homeless Management Information System, or HMIS. And it's essentially a free client management system. So if you think about, your workplace, if you have to put data in anywhere, it's essentially that, but for like the information of people accessing homeless services. In Greeley, we have 6 different agencies that uses HMIS, and so we can use that as at an aggregate, like big collective level. We can use that data to understand people's movement to housing and their needs and kind of where there's gaps in the system, that kind of thing. It does not, I want to note, it doesn't include anyone who is accessing services from a victim service provider. So in Greeley, that's a woman's place. Those folks experiencing domestic violence are all kept confidential. So we do have kind of a separate process to make sure that they are included. They're just not in this shared database. The other thing we manage every year is what's called the point in time count. Some of you might have heard of that. It happens every year in late January, where we have kind of implement this snapshot count of people who are sheltered and unsheltered by doing individual surveys with the folks that are not regularly accessing a program that we already have their data from. Honestly, this is the meat of what I wanted to say. So the point in time count, it happened on January 24th. We counted 308 people in Greeley, Evans. Of those, 220 were sheltered, 88 were unsheltered. And then so that's this, the graph on the left is the point in time count. So that's a total of 308. We did, and again, this is like sending people out, trying to survey, mapping everything. We have to get this data and send it to the government for their government purposes. We just ran a report. We used our shared database and we said, okay, 3 months later, on April 24th, how many folks are enrolled in a program and they're not housed? And that was 462. And I think it's important to note that that was after the cold weather shelter closed for the season. And so just 3 months later, we had 81 people who were identified as being in a shelter situation, and then 381 people that we can determine they're presumed to be unsheltered. They're experiencing homelessness. They're using a service that's intended for people who are currently homeless, but they're not staying in shelter. So that's just to kind of take a snapshot. The point in time count's helpful, but really it's a lot. There's a lot more to it than that. With that, how are we housing folks? I will say we're trying our best, but there's really limited resources. So on average, we have about 4 to 5 openings for housing resources, whether that's a voucher or rental assistance or something, so 4 to 5 a month for all of Larimer and Weld County. So if we, this is just, right, so 400 and something, just in Greeley, we get 4 to 5 a month total for both counties. But I will say we can see a pretty significant reduction when new resources come online. So we're going to hear about the foundation's housing team and what the work that they're doing. We have our Rising Star PSH, Permanent Supportive Housing program that is hopefully going to come online soon. So that's really important, just knowing like if we have those resources, we can actually make a dent because we have this whole system that's in place to get people identified and housed as fast as possible. So I'll stick around after this. I have my card, but this is my information. If you have more questions or anything, I will plug our website. We have a bunch of dashboards similar. They look really similar to the one that you saw from the health department, but if you're interested, please take a look because there's lots more to it. So, thank you.
So one thing that I really, Kelly and the folks that have been part of the COC for the last 2 years, they've done an amazing job, right? It's startup. They're starting a new business, right? It's a not-for-profit, but essentially it's a new business. And so when I was in Amarillo, before I came here, I was director of community development. Community development was organized a bit differently. We were the lead agency for the COC, so just like what Kelly was talking about. We had the Housing Authority, we had the CDBG grant, we had the home grant, and then we had all things kind of related to homelessness as well. And I have to say that it was really, really a struggle to get people to start utilizing HMIS, right? We needed the data, or we didn't really know what we were doing. The thing that really helped turn the corner on that was when I was able to show them that HUD says every year, based on our population and demographics, we should be getting $1.1 million in Amarillo COC. And in fact, every year we were getting $556,000. And it was because we were doing such a terrible job with our data management. And it wasn't because, people weren't bright enough to do it. No one had told them that. No one had made the link to how we do with our data and those performances and how that's linked to dollars. And so that's the same thing here. That's one of the reasons we really are so focused on increasing our data adherence and getting people to utilize HMIS. Hold on, excuse me. I get terrible, like I get really nervous when I do training and consulting or talking, except I did do training and consulting for 5 years. So, and I'm just gonna tell you a quick story. The very first presentation I had to do, SUNY Albany, I was going to undergrad and I was in, I think medical sociology was the class. I was presenting on schizophrenia. And I had what we would now call a panic attack. It was unbelievable. I couldn't breathe. I was heaving, but I didn't know what this was, right? And this is 1996. And so, I continue. What are you supposed to do? I remember sitting down and looking at the students' faces around me and the horror that they had on their face. Like, what the heck just happened? So, anyway, but part of it is because I care so much in terms of the topics that we're discussing. So, but the thing that I think is terrifying about Kelly's presentation is that 400 people in Greeley, right, on the list? Okay. Right. Okay, so 462, and between two counties, every month, we have 4 housing resource slots. Like, so we're done, right? Until we find other resources for both housing, and that's just housing dollars. That is not including the support services. And for many of the people that we're working with, you must have both, right? You have to have that rental subsidy, but you also have to have intensive case management services. And so that's, one of the things that is our charge, my charge, to work with our partners on, we have to turn that around, or this issue that is a huge concern for folks here in Greeley, and understandably is never going to turn around. It's just going to keep getting worse. I will say that I think the fact that Greeley is understanding that and said we need to do something now is fabulous. And so we're going to. But I think it's really key for us to understand the context in what we're dealing with. Okay, well. So, Kelly talked about this, so I'm gonna move on a little bit. So the team that we were able to start up, and a lot of people ask, okay, so you got $1 million from the city. What the heck are you doing with $1 million? And so the deal is the first budget was half of that was for rental subsidy, right? Because I can't say I'm going to go work with someone that's homeless and that I'm actually going to be able to help them if I don't also have a source for housing. And so originally we were only going to be able to serve 30 people. And then, like 6 weeks after being here, I saw this grant, and I don't know. It's crazy that we got it. I called North Range. I said, "Hey, I'm here. Will you partner with me? Sean, United Way, can we please partner together on this?" And then Zach, do you mind standing up, Zach, for just a minute? So Zach, who is in the Office of Supportive Housing at DOLA, he was very, very helpful and understanding. And so by getting that grant, we were able to, because it came with 60 vouchers, right? So 60 housing slots. We're hearing that between our two communities, we get 4 or 5 a month. This is 60 permanent housing vouchers. And so we were able to expand to go from serving 30 to now serving 60. But we're all in startup because when I came here, you know, I had tremendous support, but it was just me. And I was like, we gotta get some folks on board because I love working with people who are homeless, but that's not gonna, like, I can go meet them, but that's not gonna help them in any way, shape, or form. So, but without that grant, we would not be able to be moving forward. So in terms of folks who are chronically homeless, I want to say that those are people who have, and the reason I wanted to focus our population on that was, one, that's the population I've worked with most. My background as a clinical social worker, I started out in the area of mental health. I love working with people who are dealing with a lot of complex needs. And also, those are the people that tend to use the greatest number of crisis resources, and which are very, very expensive. So going to the emergency room frequently, meeting with Brian, our chief of fire, and having to deal with, sending their ambulance out, and oftentimes it's not an emergency, but it's because of someone not having a safe and stable place to live. And same with our police department, right? Right now, they are the ones who are probably interacting the most with people who are experiencing homelessness. That's not what they signed up for. That's not what they wanted when they became a police officer. And certainly we need them to be doing other things, right? There's better ways to serve people who are homeless than having to use our police force to do that. So we're focused on this group of people. And to work with this group of people, you cannot just place someone in housing, right? These are folks who have been often on the streets, the folks that I've worked with 10, 15 years, like I said, dealing with many complex needs, and they've been through all those other programs. And those other programs that are more sort of clean and sober, step by step to getting housing, those are great, but they haven't worked for this population. And so if we're ever going to be able to house them, then we needed to kind of do something different than what we currently had available. Okay. So just to hit home a little bit of the cost-benefit analysis, this is Mr. Ali. So started a team in Amarillo. The first Housing First team I was on was in Philadelphia, and then I worked in New York City. And Mr. Ali is an amazing gentleman who lived for 7 years, off and on. The off would be when he was in the hospital, behind the V&M liquor store. This is in Amarillo. And he had, you can't quite tell, but one of his legs has been amputated to the knee, and then his foot on the other side was also amputated about halfway because of diabetes. And so there were years he was behind that liquor store. Yes, he was drinking, and rain, snow, sitting there in his own feces and urine and vomit because he's not able to change himself. And, it's quite a travesty. So, and he couldn't go to shelters because the shelters said, we cannot, we don't have the skills to help him transfer to the toilet. So there he was, V&M. So one of our outreach staff, when we were starting our team, met him, and we were able to get him into housing. And I was working very closely with Northwest Texas Hospital, and he signed releases of information. And what we found, the year before he went into housing, he cost them $1,600,000, right? Tremendous amount of money because, you know, he would get infections, he had a lot of chronic illnesses, and then once we got him into housing, the first year, and I hope this stays the same, you know, I've left, I'm now here in Greeley, but no hospitalizations, right? He didn't need that because he now not only had housing, but we had people going in and checking on him, bringing him to doctor's appointments and monitoring medication. And also, I think he greatly reduced his drinking, and part of it was, this is terrible, but he couldn't get out, right, to drink. But, you know, he was okay. He never was like, I want to go back to the street because I want to drink. He loved being in his house. And the landlord that we worked with, absolutely amazing, took a chance on this gentleman, realized after the first week he had to pull out the carpet, right, because of his incontinence. And so he did that and continued to work with us. So, I mean, I believe everyone is truly compassionate and cares, but I also think that the cost benefit analysis is what has really helped when Housing First was first started, kind of become popular across the country. And that is the model that the VA has utilized when they were changing their program. And the VA is the only agency that consistently says they're reducing homelessness. And that's because for every person they serve, they have a voucher, and they also have a full team of case managers, 12-to-1 caseload, you know, 10-to-1 in some places. And then they also have a whole hospital, right? Mental health, primary care. I worked for a VA. I'm glad that they have it set up. They also need to develop more urgency. Okay. It's a little editorial, sorry. I partly feel that way because my father was a veteran, and he didn't need to use the VA services, but he talked to me frequently about how our veterans have put their life on the line to preserve our freedom. And that, you know, I think that's a pretty amazing thing. And that they should be treated. I mean, everyone should be treated well, but I also think that we can do a lot better in terms of our hospitals, the VA hospitals. Anyway, different sources of funding for people experiencing homelessness and programs. And so you see HUD provides money through the COC, through our housing authorities, Community Development Block Grant, and the Home Grant. And so currently, the main source of funding for people experiencing homelessness here in Greeley is the COC. And so we know that that is completely inadequate at this point. Not that it's bad, it's not anyone's fault, it's just that is the amount of funding that's coming through for Greeley. And so one of the things that we could look at that hasn't been done before in Greeley, because the home grant comes to the city of Greeley, is you can use that for rapid rehousing. We wouldn't use that for the people that we're targeting, but for people who maybe just hit homelessness, right? This is their first time homeless or been homeless for 2 weeks. We can easily use those dollars to get them back into housing. And the greatest, though, would be prevention. And I'm going to get to that. And then our housing authority. And that's something, I mean, our ED, Tom, is here, and he knows I'm talking to him all the time about this. Like, how can we use more of those vouchers to work with people who are homeless? So that's pretty much about right. So this is the City of Greeley's foundation team, and I'm just gonna ask them to stand up just real quick, if you don't mind. turn around. Okay, and so Joanna, I bet you many of you all know her. She is an RN. She has been in the community for a very long time, working in the areas of both behavioral health and community health, and just amazing that I was introduced to her and that she agreed to come work and do this. And then our other folks, our case managers here. And when we were going through interviews, I explained to them that this job is going to be really, really, really hard. And it's not going to be 9 to 5. You're going to get tons of comp time. I mean, they're already working weekends, right? Because one of the things that we're doing is meeting people and meeting people, and we're using a couple of the different hotels here in the city, because then we don't lose them, right? It's hard to continue to follow up with someone. You keep going to the bridge. Maybe that bridge was then set up for a cleanup and they're gone and all their stuff is gone. So this is a way for us to be able to be a lot more efficient and build our relationship and get things done quicker so that we can move them into housing. But they're in a hotel, and so we're going 7 days a week to make sure things are going okay, because we're also very aware we need to maintain really positive relationships in our community. And a lot of these folks don't necessarily have a background in social work, which was very purposeful. I was looking more for people who could truly embrace the attitude of whatever it takes and compassion in a non-judgmental stance. I'm a social worker. I find many social workers to be quite judgmental. I mean, sorry, bummer, but it's the truth. So, but because, and I knew Joanna had great skills and clinical understanding, that she would be able to provide training. And we are sending them out to see a team in Vermont that's been running this kind of program very successfully for several years. So anyways, I'm grateful that you all agreed to come and do this. Thank you. And I am going to get them different shirts. I will say, our city manager said, I want to be able to see them when they're out in the community. I said, absolutely, I get that. And so Wendy, who is helping order the shirts, I was like, I need the brightest color. I had no idea it was going to be quite that bright. But, so, it's good, but we'll also be getting some other shirts. And so it's super important to understand housing first is not housing only. And in fact, the gentleman who created it, Dr. Samson Barris, he actually talks about it as it is a clinical intervention that has housing as a component. And I was very fortunate and have a very unique experience that I was able to work for him for several years, and he absolutely is my mentor. This video is very long. We're not going to watch the whole thing. We're going to watch about 4 or 5 minutes just to give you an idea of what it looks like once someone is in housing and what these teams do when I talk about a home visit. And so this was filmed in Philadelphia, and it's kind of old. I should get a new one. But anyway, it'll give you a sense.
First has 2 program requirements. One is that the person has to pay 30% of their income towards their rent. And because it's a program that has both treatment and housing as their component, the person must agree to having us visit once a week. Visit.
If you start to run the numbers and you see how much time you have face-to-face contact with individuals, it's not that much. It's really not that much. How many people on your caseload? 60, 80, 100? You better have a good idea of what it is that you're trying to accomplish.
The home visit is like really the heart and kind of soul of the work we do, because you know, I think that's ultimately where you want the change to happen, you know, in their environment. And so it's important to kind of support them and assist them in their environment.
Now, it's not a visit that's a treatment visit, and I think this is an important distinction. It's a visit much in the way that you would visit a relative.
Hey, James. Good. How you doing? Good. Good to see you.
You know, like a how you doing visit, and sort of checking to make sure that they're okay in the apartment.
We do home visits for a couple reasons.
It's the bedroom.
Ultimately, we are the housing provider. Things break in the apartment, not because of what the consumer did, but when you're renting an apartment, things break. Bedroom looks great.
Thank you.
It's important to get on that, to keep landlords accountable to their responsibility, but also keeping us accountable to what we need to do.
You know, it's a visit like other home visits of care and concern.
Hey James, you wanna talk at the couch? You get a more candid picture of how they're doing in their apartment, how they're doing psychiatrically, whether there's any issues coming up. You know, I actually saw you yesterday. It was right up here. It was in Germantown, Shelton, and you were by. And I almost like beeped and like jumped out, but I was like, oh, I should get going. But I was like, oh, I'll see you tomorrow.
Okay.
So you get around a lot on your bike.
Yeah, a little amount, yeah, around the neighborhood.
Mm-hmm.
Yeah.
You ever bike into the city or anything like that, or is that too far?
No, well, it's not too far, but I bike because I wait for a little more comeback. Now I'm feeling a little more comeback.
What's that mean? A little
Well,
more
that just meant the body's feeling very normal, like, you know. So that's what saved me. I could not exercise before, so I used the bike to exercise. You know, and you build some little amount of muscle coming back up in the legs real slow.
I did want to focus in on his health because that has been kind of a window into engaging him.
It's a program, right? It's not a housing authority where a person gets an apartment and they go. It's a program.
It's not like, hey buddy, how you doing? Good? You good? How's it going? Good? Take your meds? Yeah? Everything all right? Good? See you tomorrow. Good? Right? And you come back to your team, you know, how's buddy doing? Good. That's not what we're doing here, guys. It's a targeted intervention.
How have things been going with Dr. Laura?
Well, things been going great with Dr. Laura, yeah.
Just taking the medications they have you on affect your body?
This affects my body as sweat out.
So is that uncomfortable for you?
Yeah, it's uncomfortable, but
Have you told her about that?
no, I didn't tell her about that yet because
Some of the assessments that are going on kind of blend into just hanging
this
out.
might be the final blood test.
You get certain cues, like if the person is typically talkative and they're kind of reserved, and that might be a cue if something is going on. If they're usually well groomed and they have a less clean look, and maybe things are kind of deteriorating psychiatrically. You get clues into what's really going on in their apartment. And in a practical side, we can support them the best way we can.
And this is on YouTube if people would like to see more, you certainly can. But I really appreciate Adam when he is talking about that you get different clues. And when Sam is saying that it's not just a typical treatment visit, it's really, and we call it the art and science of the home visit. And the artfulness is how are you engaging with people? And are you able to talk with them and connect with them so that they are opening up? As well, also using your brain and what you've been taught about the assessments and to see how they're doing. And so for our team, in terms of behavioral health care, fortunately, that's one of our, North Range has been our partner, and that is something that we will be getting people connected with. But again, we cannot just go in and say to someone who's been on the street for 20 years, okay, look, I'm hearing you, I see you, you're talking to responding to internal stimuli, let's give you the doctor, let's get you a shot. And they'll say, okay, thanks, I'll never talk to you again, right? So we have to be a bit more, I think, caring and really understanding and knowing that individual. So this is currently what we've built, and we do have a housing director position that is currently, we have a national search going on. This housing director position is going to have very limited, if any at all, interaction with our homeless services. What their role is going to be is focusing on the continuum of housing across our community. And so working to help market Greeley to different developers so that they find it attractive and they want to come in and they want to be working here, and building homes at all levels. So for instance, I mean, we've just completed a housing needs assessment that is going to be presented within the next, I think, 6 weeks, and we're going to present it to council. And essentially what it shows is that we need to be building housing at all levels, from workforce housing to very, very deep affordable housing to executive level. I was having breakfast the other day with someone from the medical field who's one of her jobs is recruiting physicians. And frequently she will lose physicians because they're not so happy with the options that they currently have here. And that's a shame. We cannot have that, right? We're going to turn that around. And I know that our city manager, Mr. Lee, is super focused on that. And he's also super focused to ensure that what we're doing as the city is best practices, that we're being innovative, that we're not losing out on those kind of opportunities, and that we're not just being prepared for the growth that's coming our way, but that we're going to be able to capitalize on it, and that we're not going to act like a big old bureaucracy, but we're going to be a city that actually is very functional and serves the people of Greeley, which is another reason I wanted to come here, because I think that's really awesome. So, okay, for this team, we have very specific metrics, and I will say that we've partnered with UNC, who is doing a 2-year cost-benefit analysis on, so there's been 1 million cost-benefit analysis. If you do it correctly, you save the community dollars. But I also think it's important that we get really specific data. So we're focused on obviously decreasing crisis services, increasing positive health care, right? Getting people to primary care, getting people to mental health, and then having it become a consistent part of their life. And also, one of the hugest things, and it's an area, and Sam would tell you this too, is that social integration. So even after someone's housed, that's great. Their life has greatly improved. They're also still dealing with poverty, tons of loneliness, disconnection. And so that's an area that we are still working on. And so sure, there's volunteer opportunities, there's employment, all of those will be options and things that we'll do. I will say one of the things that we saw a lot in Amarillo is because was neighbors who became very friendly, like, because they saw our case managers going all the time, and we couldn't tell them like everything we were doing, but they had a sense, and so they've befriended many of the people we were serving, and that was actually one of the greatest pieces of social integration. And I will say one of the benefits of the scattered site model is people will norm to what's around them. And that's can be very, very helpful when people realize, like, you cannot be walking out to the mailbox like in just your underwear. You know, it's important to put some clothes on. So, and you know, and it's like if you were living out in the woods, who cared, right? Like what you were wearing. But now people do. I will say that it's good to have both, the single site and the scattered site. So what Jody's doing is going to be the single site model. And for people who, you know, we house them and their apartment gets taken over. Could be by a predator, it could be because they feel so guilty that they're in housing and their companions from the street aren't, and so they bring them in. And so we work with folks on that, and then part of the model is rehousing people. But at a certain point, when you realize that this person is just is always gonna let folks in, having the single site model where you have a staff member, security person who is monitoring and watching who's coming in and out is very helpful. And then this is our timeline. And so our folks, all of them, 60, housed by August 2024. You know, I'm going like this because I'm like, I want us to do that much sooner, but at the same time, I want us to be very realistic. And also, Dr. Sampson Bears is going to be doing case conferences, not just with our team, but also once a month with the community. Any of our community providers who are interested and want to present somebody and, have Sam's expertise. I mean, he's a clinical psychologist, right? So he didn't just create Housing First, he's also just very much a brilliant guy. And then these are some other goals that we have. Okay, so I'm going to point out working with the community on an extreme weather process and policies and encampment cleanup, right? That's a huge issue. One of the reasons it's super hard is that when the cold weather shelter is closed, people really don't have a place to go where you can show up that day. We have places, but they're more sort of programs, and it's not like emergency show up that day. And so, but when I was here, I was like, how do we get told, if the encampment needs to be cleaned up? And it would be some people would call Becky, some people call Chief Turk, some people, call Will in Public Works. And it was just chaotic. And so we've had these two amazing work groups working on this. So one on the encampment cleanup process. And so they've created, and this is something they've worked with the county on. So they have a whole matrix to figure out of the encampments, which one do they need to attack first in terms of going out and really saying, okay, this is one that we need to clean up in 48 hours or within the next week. And there's right now a button on the Public Works page. The goal will be to have that on our, city website, the very first page, so you don't have to hunt around for it. And then once someone puts that in, then it triggers all of us to be looking and doing our part. And so the first people to go out is the team to connect with folks and see, do any of them qualify for our program? Are there any folks that we can connect with other services before they have to move on? And and it's a terrible, when you think about the resources used on these cleanups, and then people are just moving and you're gonna have to do it again. And at the same time, when the E. coli percentage is increasing in our water supply, you can't have that, right? If people's businesses are being affected, which is how they feed their families, we can't have that. So I absolutely understand both. But that's why we're so desperate. We have to get more housing resources and more case management support. Okay. So, prevention. Obviously, if we don't have prevention, then what are we doing, right? And so right now, though, it seems as if the county, with their emergency rental assistance program, is focused on that. And I think that's an area that perhaps our county partners could even expand. And I do think one of the things with prevention is working even further upstream to identify people before they're even getting an eviction notice, right? As soon as, these are some of the warning signs that things are about to go downhill. How do we help them at that point? And so this is like the Candyland thing, right? And so if someone is almost to the finish line, but then they, have a terrible, their car breaks down and their child is ill, and so they miss work and they get fired. We don't want them going all the way back to start and then doing it all again, because to me, it just makes zero sense. If we can, they only go down maybe 2 or 3 and we can get them back up. So this is potentially, something I've been thinking a lot about, because we've talked a bit about, do we build a shelter that's year-round, that's low barrier, or do we do this huge push to try to house folks? And it might end up being that we might have to actually do both. But one of the things that I've been thinking about is if we could get different groups together and for $25 million, support our different agencies for 5 years, right? And then we'd also have to have a commitment from the different places, the state, our housing authority, that they would provide vouchers for people. And then the idea would be people, I mean, this is most sustainable source of funding for the services is Medicaid dollars. And you can bill Medicaid for a lot of the case management services that are happening. And so that's why I'm saying 5 years, so that the teams would be able to build that infrastructure in so that they can then start billing Medicaid. And, you know, perhaps the teams who get it done before 5 years get an incentive, right? So. And what I think is if we do this, we will be the national model for cities of our size. Because there's a lot of cities across the country that are grappling with this. And so if we could do this and help other cities not go to the point where we're at, even though I think Greeley's doing great in terms of focusing on it now, it would be wonderful to be part of a community that does that. So that is it for our presentations. And I got to say, thank you all so much. Questions? Anything? All right.
So I don't know if you've thought about this concept, but there are other cities in other states that have done a tiny house community exclusively for the homeless. Has that something the city of Greeley has considered?
I think we recently had a code change so that we would be able to do that. And I know that was something that Becky was working on. And I would say that anything we can do to increase our availability of housing resources for people, absolutely. That's something we need to be open to, for sure. Okay, Mr. Teets.
I'll try to keep this short. First of all, Weld's Way Home, which is from First United Way, they have 2 reports. Weld's Way Home's been going for a few years, and both reports are excellent. And I would recommend that each go to United Way and see if you can get those big reports, not the condensed one, the big one. And also, a few years back, I don't know exactly when, you can get a copy from United Way from this, AARP did an assessment around Greeley as well. And another thing is, well, you answered my question on preventing homelessness. Also, you have in your literature here, why are people homeless? And then you got a list. But there's a lot of barriers besides what's on your list here. And I'll just name about 4 short. First of all, that employment and transportation has a lot to do with it too. And in Greeley, well, I'll be not politically correct, we got a disgusting bus system, and a lot of people, not just people that are, quote, normal, but people with disabilities and seniors. And also, too, that lately we've had problems with keeping people in homes because Bonnell used to be the biggest nursing home. And then we got also Hope Apartments. They're told they had to leave. And also there's a apartment complex across the street called Birchwood, and they have new owners. And then some of the tenants there are having trouble with the new owners because they're making it hard on them. Oh yeah, the point in time. And no offense to this, especially from the federal government, but the point in time doesn't really cover much because you got people, as they said, double up. You don't get that. Even if they are out in the stars, a lot of them probably have never taken that survey anyway. So I don't believe, no offense to you or anybody else, but we don't hit the ballpark. And people are in their cars as well. And then sometimes they're driving without a license because in Colorado you got to have a stable housing before you can get a driver's license, which I think is not a good idea. Thank you.
Well, first I would like to compliment you on your meeting. I went to a meeting that they had at the Weld's Way Home, and it was a disaster. Some of the drunk people came and took over. It was like the inmates had taken over the asylum, and all the people who were pencil pushers in the office and had never dealt with homeless in their life, they had the deer in the headlights look. So my compliments to you. It was very well run. I will admit to being pretty darn judgmental. You can't go to the park near Hillside and have lunch without somebody hustling you. The other day I went and there was a guy, one pant leg was intact, the other was not. He was showing everything his daddy gave him. I'm 73 years old, I could have a heart attack. Wasn't too long, I went to King Soopers and somebody called the police. About 2 weeks later, I went to 7-Eleven and she saw him out in the parking lot. And she was like, "Oh God, Brandon, please don't come in." Okay, about a month ago, I live over near the college. Greeley really courts that college dollar. If their parents knew what was going on in the house across the alley, there was a big raid last week. Police on one in the front, police in the back. This guy had held the whole neighborhood hostage since he moved in. I don't know if he was running, of course, the police won't tell you anything. I don't know if he was running a drug house, gang activity, what. Everybody was diverse. But the house had been empty for 2 years. I don't know how they figured it out. The owner's still paying the utilities. But he had an endless stream of lowlifes, and I'm sorry, I've worked in the criminal justice field. I can recognize one when I see one. Up and down the alley constantly. People were finding stuff missing all the time. The guy was burning trash. I had to close my windows because I couldn't breathe. All the illegal trash burning. He was putting his own trash in everybody else's dumpsters. And I tell you, he was pretty successful. He had a lot of clients. I don't know what they were doing. I don't know anyway, I'm gonna quit. But I think it's wonderful what you're doing for the homeless, but what about protecting us? I was sleeping with a hatchet, and I had my car keys on the bedpost so I could press the panic button. And anytime they come by, I'm nice to them. But, the ones that have been in prison have learned manners. They are very nice. They'll say, "Hello, have a nice day." It's the little gang wannabes that are mouthy, and, they're the ones that are tagging all the garages. And, I think it's wonderful what you're doing for the homeless, but what about us?
So, first of all, yes, go ahead. So, I would say thank you so much for coming, and that's, I think, takes a lot of courage to say that in this crowd, right? And you're 100% right that, of course, you can't have that. You can't live a quality life with all of that stuff going on. And it's horrible for the people who are homeless. And I do think, though, that there is are there some people who are doing criminal activity within our homeless population? Absolutely. There is no segment of society, hashtag Bernie Madoff, that does not have people who are participating in criminal activity. And so people who do that, right, breaking the laws, we need them to deal with the consequences of that.
And I'm not going to represent anybody here, okay? To your point, and I'm not trying to make this like a forum or anything like that. I understand where you're coming from. The problem that we're experiencing, because I've worked with people that are homeless for years, the problem that is the biggest problem is when you stigmatize them and you judge them. Because the majority of them are decent people. They're good people. They have mental health problems. Just because they're out there doing things that you think are odd does not mean that they're criminal. There are very few people, and again, that's the stigma. There are very few people that are actually criminals. There are very few of them. And that is the problem on a community level basis that people have to understand is if you stigmatize and judge these individuals and think that they're low lives and criminals and that they're not going to make a difference or they're not going to, do anything. I've housed over 100 people and they've done so well. And when you break that stigma, because it affects them too, they are individuals, they are people too. When you're able to help them and reach them, and it takes a lot of time to do, when you're able to help them, they can become productive members of the society and help the community instead of, put this damper on it. I understand it's a safety concern. I get it, but you need to treat people with compassion and not just immediately jump, because a majority of them are not bad people.
Kristen, thank you. I think that's of course, that's always the case. I will say, I don't think I heard you being judgmental. You were concerned about the criminal activity. And the bottom line is, we do need to do more education and understanding to help reduce stigma for people with mental health issues, for people who are homeless. But I also think the bottom line is, if we can get people housed and help them stay housed, it will be a reduction for both concerns, right? Yes, ma'am.
Hi, Juliana. I'm on the Housing Authority Board with Juliana. I just have a couple of questions. So you mentioned that there is criteria that people have to have in order to be a part of the program. I'm curious what that criteria is. The other issue that I see from my perspective on the board is that there are times when we house people and then they smoke meth in a unit. And then that unit goes down for 3 months for cleanup, and there's $30,000 that we have to spend to clean up the unit. So I'm wondering, in this process, have you budgeted to account for things like that?
So in terms of the criteria, we have 60 vouchers. We have 2 populations, right? We have 30 people who are what we call swishy referrals. Zach, do you know what swishy stands for? It's a Medicaid expansion demonstration project, right? Looking at if Medicaid paid for these services, would it ultimately reduce their costs? And so for those individuals, Kelly's by name list, so she has reviewed that list and said, these are the people who have the greatest level of need. Then we send it to the Housing Finance. Thank you. HICPUF, right. So then we send it to HICPUF, and they do a verification that, yes, this person has been hospitalized, using emergency services, they qualify, right? And so then we can start working with them. The other 30 are people who, for our priority, people with very complex needs, have a disabling condition. Many of them absolutely meet the definition of chronic homelessness. And because we're very fortunate, right? This amount of resources that we have, we want to make sure that we are working with people that our other agency, who's been they've all been doing amazing work, with obviously such a scarcity of resources, that we take those that then they can take some of the pressure off of them, and so that they can serve people perhaps with more moderate needs. And then Zach and Dola and their wisdom have provided additional dollars for both landlord incentive and deposits as a way to help deal with some of those issues. City, it also included some dollars for landlord indemnification. Because, I understand that landlords are our clients too, right? The neighbors are our clients too. And so these guys, they're on call. And so they're on call not just for the person we're serving, but also for the landlord, potentially for the neighbor.
I have a question for you. Yeah, we're dealing with people who need housing. What are we doing about those who don't really care about housing because they want to stay in their addiction? They don't like rules. They don't want to have to answer to anybody. And there are a pretty fair number of them out there.
So I think that's really where the fact that this is a clinical program that has housing as part of it. And so understanding, and first of all, right, people are individuals. What's going to maybe connect for one person might not connect for the other person. And so, but we have to have many different options available for people. I will say that, so, you know, I've been doing this work for, see, I graduated 2000 from my master's program, 23 years. And so 95% of the people who I've worked with, when we offer housing, right, that's their own, just like anybody else. And we also have to say, though, you got people with like really bright green shirts that are going to come see you. You know, most of them are okay with that. The people who have been resistant, usually they often have a fixed delusion. Like there's this one woman in Philadelphia who believed that she actually owned like a penthouse in our like kind of wealthiest hotel, and so why would she take our housing? And you know, and she she would work with us if we could connect her with lawyers. And so we started to do like legal aid and things like that as a way, like, can we connect with her? And so we can eventually perhaps move closer to housing. But and so housing first, the success rate is 85% success if implemented correctly. And success is people not returning back to the street. But it's not 100%, certainly.
Thank you. Our church feeds the homeless 3 days a week, but because there's a positive factor in their life, they come to camp underneath the portico on one side of the church. It's shelter from direct rain, maybe, but the defecation, urination, graffiti, theft, vandalism, there's signs posted saying no loitering. If there's no services going on, no food program going on, except you drive by, you ask them to leave, they might leave or they have kickback. But do you have resources that, okay, we can hand them a card, say, here, contact this person, instead of just saying, please leave, because they're all tarred with the same brush, whether they're.
Absolutely, and it sounds like obviously you have provided a place where they feel welcome and comfortable, and I think that's excellent. But at the same time, it's for that period of time so that they have food. And again, like, because we don't have a shelter except for November. Right, and so one of the things that, so this team, right, I've asked them actually to go to your place, because every night I drive home, I'm seeing several people. And so I know that they have started to do that. And I'm sure several of them will qualify for our program, but maybe not necessarily all of them. And so the other thing too is that we don't have like one number you can call and have people who are doing outreach, like that's their job on a regular 7-day-a-week basis. And there is a grant that I'm looking at applying for. I talked to our partners and they said that was not something they were going to apply for. So I think that is a huge gap. But then I think, okay, so outreach, and then we can help people like get the things they need for housing. But if we don't have the housing, you know, what are we outreaching to? And I got to say, during the point in time count, these groups participated with us, and they did some of the surveys, and so we appreciate that very much.
I'm actually going to turn this over to Sean, but I think it's a real important thing to understand. We do have the Housing Navigation Center and a lot of services being done for the homeless. So until we have more robust housing and a lot more outreach capability, there's still quite a bit of resource there.
Yeah, and a lot of the people you talk about probably know about the Navigation Center, but we do have showers and laundry, which are new this summer that access for free. Lockers, you know, give people birth certificates to get them prepared for permanent housing. Like Juliana mentioned, the services are a Band-Aid until we can get them the permanent housing quickly, and we can't do that until we have more housing resources. So feel free to send them over to the Housing Navigation Center. It's on 28th Avenue at the end of 28th Street, start at the end of 8th Avenue. in Garden City / Evans / Greeley. It's right on the corner of all three. So they probably know about that. And our staff works with Juliana's team very closely to do some outreach. Yeah, we have lockers. We only have 32, 38 maybe right now. And we usually have a wait list during the winter months. I think right now we don't have a wait list, so we have empty lockers. We moved last May, so we lost contact with some people. They may not know we moved. So yeah, it's not enough services for all the people who need it, but there are some options available.
I will say, every time I go to the Housing Navigation Center, they are always working with people, and they have 2 or 3 folks who are waiting. We created together a community resource just for like summertime, once the cold weather shelter closed down. Emma, do you know, did we put that in the packet? If we didn't, we will, if you've signed up, be happy to email. Oh, look, Jenny's helping me. No, we did not. That's okay. That's my fault. I apologize that I hadn't thought about that. So, because I think that would be a help, because truly, right now, that is, the Housing Navigation Center is where people could go and be welcomed. Oh, good. We got Zach.
Juliana. Hi, everybody. So I work for the Colorado Department of Local Affairs, Division of Housing. We're an executive branch agency. And so I know these conversations about resources are always really tough, but I think now is a really good time to I want to congratulate, Greeley is doing amazing work. Like Northern Colorado is doing fantastic work. Not every community is disengaged and talking about housing and homelessness in this way, is talking about solutions. And is talking about what you can leverage locally. And Greeley is a community that has really stood up, and that's why we've been able to provide the resources we have, is because folks are saying, okay, we want to do what works, we want to implement best practices, and we want to be a partner in doing that. So just want to say thank you, right? It makes us easy to do what we're trying to do at the state, to make homelessness history, to ensure that everybody has a safe, stable place to call home. And that's because of the really hard work that folks in this room are doing. Right, we have some new funding opportunities at the state level through Proposition 123, which voters passed last year. We've had some American Rescue Plan Act dollars. We want to keep those wins going. We've had some renters' rights bills and other legislation that's moved this year. And so those resources, we were going to continue to build on the successes that you've made possible, and we want to keep doing more. So thank you.
I know we're talking about homeless, but yeah, there's a whole raft of people that would be homeless. We have a little over 1,200 families that slept under a roof that we either own, manage, or we pay the rent on. Our biggest program is the Housing Choice Voucher Program, which has roughly 1,000 families at a cost of about $800,000 a month. Now, the average income on someone on our program for vouchers is about $15,000 to $16,000 a year. Our average income, for people in our public housing is about $24,000 a year. And we have the spectrum. We have seniors, we have people that you see in wheelchairs that have been in a wheelchair their entire life, that are in the community. They may be working, they may not be working. We have young mothers that have had 2 or 3 children starting in their teens. And basically, it's a little hard to raise kids without a high school education as you move on. So we have a variety of people. What we don't typically take is, unfortunately, because of the needs for the rest of the community, is what we call an able-bodied single. That's someone under 62 that is able-bodied. They're not handicapped, et cetera. Now, we need programs like this for those folks because they're in need from a variety of different reasons. Sometimes it's just falling into the situation. Sometimes the drugs come after they fall into the situation, or the alcoholism. And, there are a whole raft of different reasons why people become homeless.
Thank you, Tom. And I would say that the folks who are in our program, I don't think anybody would call them necessarily like sort of able-bodied in terms of the way you were describing. They're dealing with really complex needs. And I think for the people you're describing, more of a kind of rapid rehousing would probably be a match. But I think the you know, we have such a need for folks who need more of the permanent housing and the wraparound services. So, yeah. All right. Thank you. Thank you. Thank you so much. Very, very grateful that you all came and hung out.